Welcome to your 2017 Annual Enrollment Presentation. My name is Misty Leslie with your benefits broker, CLS Partners. All benefits discussed during today's presentation will become effective on January 1st, 2017. During our discussion, we will cover some important takeaways, review this year's benefits and plan costs, walk through the enrollment process, and discuss the resources that are available to you should you have any questions. Let's start with some important information. This presentation provides general information only and is not intended as legal advice. In the case of any inconsistencies between the information presented here and the plan document will always prevail. Your plan year begins on January 1st, 2017 and continues through December 31st, 2017. Your annual enrollment period begins on Monday, November 14th and ends on Wednesday, November 30th at 5 p.m. Central Standard Time. All plan elections must be received prior to the end of your enrollment period. If you currently have coverage, now is your opportunity to make any changes to your benefits, such as adding or removing dependents, changing plans, or opting out of coverage altogether. Elections and changes made during the annual enrollment period will remain in place until the end of the year on December 31st, 2017, unless you experience a qualifying event. A few examples of qualifying events might be marriage or divorce, the birth or adoption of a child, gaining or losing health insurance for yourself or your eligible dependents, including the termination of Medicaid or CHIP coverage. If you experience a qualifying event, you must contact Human Resources within 31 days of that event to be eligible to make changes to your benefits. As a quick summary on the benefits we'll discuss during this meeting, you will continue to have 2 medical plan offerings, but those benefits will now be through United Healthcare instead of Aetna. We'll discuss those network and plan design changes momentarily. Your dental and vision coverage will continue through Aetna, and your income protection benefits will remain with Sun Life with no changes. Your flexible spending account will also remain unchanged with Task. Let's review your medical and prescription plan options. As mentioned previously, you will continue to have the 2 medical plan offerings offered through the new carrier, United Healthcare. Another important change that I would like to point out is the type of medical plans being offered. Previously, these plans were what is known as a PPO plan, which offers both in and out of network benefits. Effective January 1st, both plans will be EPO or exclusive provider organization plans, which exclude out-of-network benefits. What does that mean to you? It means that any services rendered at a provider that is not part of the network will not be covered. To confirm your provider's network status, please contact your benefit advocate with CLS Partners or visit myuhc.com. The network for both medical plans is the Choice Network, and each offer similar benefits. The biggest differences are with the deductibles and premium costs. Let's take a look at the deductibles. The individual deductible on the base plan is $5,000 and there's a family deductible of $10,000, while on the buy-up plan, the individual deductible is $3,000 and a family of $6,000. Once you've met that deductible, your coinsurance will kick in. The coinsurance amount for both plans is 80%. This means that United Healthcare will pay 80% of the negotiated charges and your patient responsibility would be the remaining 20%. Now for the out-of-pockets, which are the same on both plans. The individual is $6,500 and the family is $13,000. Your coinsurance and copays, including your prescription copays, count towards satisfying your maximum out-of-pocket. Both plans cover preventative care at 100%. A few examples of this care might be childhood immunizations, annual checkups for your children, well-woman exams, or physicals. For a complete list of preventative care, please visit myuhc.com or contact CLS Partners for assistance. Now let's look at your costs for doctor's visits. On both the base and buy-up plans, office visits with your primary care physician and virtual visits will be covered with a $0 copay. Specialists on both plans will have a $100 copay. Emergency room visits are covered at 80% after a $250 copay and deductible, and urgent care is covered with a $50 copay on both plans. Both plans cover most services and prescription drugs in the same manner. Inpatient hospitalization and outpatient surgery are paid at 80% after your deductible has been met. Labs and x-rays completed in an office visit are covered under the office visit copay. Lab and x-rays completed at an outside facility are covered at 80% after your deductible has been met. Prescription drug copays are based on the tier in which the drug falls into. The copay amounts are the same on both plans. For a 1-month supply of medication filled at a retail pharmacy, your Tier 1 drugs, which are typically your generics, are covered with a $5 copay. Your Tier 2 are covered with a $50 copay, Tier 3 with a $100 copay, and Tier 4 with a $250 copay. Please keep in mind that your Tier 3 and Tier 4 drugs will be subject to a separate individual deductible of $250 and a $500 family deductible. Filling your medications through a mail order program will save you both time and money. With the mail order program, your prescriptions are filled in 3-month supplies, but you are only charged 2.5 times the retail cost instead of 3. Copays for your prescriptions go towards your maximum out-of-pocket. Once you've met your maximum out-of-pocket, all remaining in-network services, including your prescriptions, are covered at 100% for the remainder of the calendar year. Once you've had a chance to review and compare your medical plan options and have determined which is right for you and which coverage tier you require, you will be able to determine the premiums that will be deducted from your earnings each paycheck. Discuss a few ways that you could save some out-of-pocket costs. First and foremost, stay in network. Please keep in mind that the benefits we are discussing today are all in-network benefits. We strongly recommend you stay in network, as going out of network can incur significantly greater costs. Also, see your primary care physician or take advantage of your virtual visit benefits for non-emergency care. Know when you can go to an urgent care facility versus when you should actually seek emergency care in an emergency room. Use generic drugs when possible and shop around, as prices for services and medications can vary widely. And now let's cover the details of your dental and vision plan offerings. You will continue to have the dual plan options through Aetna for your dental coverage. The network for the DHMO plan is the Aetna DHMO, and the network for the PPO plan is the Aetna PPO. First, let's take a look at the DHMO plan. All services on this plan are based on a fixed copay, and there is no deductible or no annual maximum on dental services. There is, however, a $2,000 lifetime maximum on orthodontic services. Your second plan option is the PPO plan. This plan does have a deductible of $50 for an individual and $150 for a family. Preventative care is covered at 100%, and cleanings and x-rays fall under this service. Basic care, such as fillings and simple extractions, are covered at 80%. Major care, such as crowns and bridges, are covered at 50%. The annual dental maximum for this plan is $1,000. This is the most the insurance company will pay out over the plan year for your dental services. Ortho, covered at 50% coinsurance, has a lifetime maximum of $1,500. Here's a look at your dental plan premiums based on the plan option and coverage tier elections. This is the amount that you will see deducted from each of your paychecks for this coverage. Vision coverage is offered through Aetna as well, and the network is Aetna Vision Preferred. Your routine exams and materials each have a copay of $20. There is a $100 allowance for frames. Contact lenses, when medically necessary, are covered at 100% after your $20 material copay. Contact lenses, when elective, have a $105 allowance after that material's copay. Please note that contacts are in lieu of frames and lenses, and you cannot be covered for both. Each year, you are allowed one exam, one set of lenses, and every 24 months, one set of frames. Here's a look at your vision plan premiums based on coverage tier. This is the amount that you will see deducted from each of your paychecks for this coverage. Income protection benefits can be vital in your time of need. Let's explore some of your options. Basic life and accidental death and dismemberment coverage in the amount of $10,000 is offered at no cost to all eligible employees. If something should happen to you and you were to pass away, your beneficiaries will receive this benefit. Please make sure to update your beneficiaries during annual enrollment or any life changes. In addition to the basic life, you have access to an additional voluntary life and AD&D policy through Sun Life. Employee life and AD&D is available in $10,000 increments up to 5 times your annual earnings with a maximum of $500,000 and a guaranteed issue amount of $100,000. AD&D are not available for spouse and children, but life is available for your spouse in $5,000 increments and $1,000 increments for children. For employees who previously declined coverage or for currently enrolled employees who are increasing their coverage levels, an evidence of insurability is required. Short and long-term disability benefits are another option available to you through Sun Life. If you were to go out on a leave after you have fulfilled the necessary waiting periods and your claim is approved, you would start receiving portions of your income as a payment from the carrier. You would receive 60% of your weekly salary for short-term disability and 60% of your annual salary for long-term disability. Your benefits would begin on the 8th day and the 91st day of your disabilities, respectively. The maximum duration is 12 weeks for short-term disability and Social Security retirement age for long-term disability. Evidence of insurability is required for employees who previously declined coverage and who are now enrolling. A flexible spending account is a great way to set aside money from your paycheck on a pre-tax basis to use for eligible out-of-pocket expenses. Maximum annual contribution for your healthcare flexible spending account is $2,250 and $5,000 for your dependent care account. Both of these benefits are considered use it or lose it, so be sure to calculate your expected out-of-pocket expenses prior to determining your elections. Your plan has a grace period provision for your dependent care account, which will allow you to continue to incur services for 2 months and 15 days beyond the end of the plan year and get reimbursed from the prior year's balance. Your healthcare FSA allows you to carry over up to $500 of unused funds to the next plan year instead of forfeiting those unused amounts. All contributions are pre-tax and your healthcare dollars are available before you have accumulated them based on your initial elections. So you've had a chance to review your benefit options and you've made your decisions. What's next? Let's do a quick overview of the enrollment process. Your deadline for annual enrollment submissions is Wednesday, November 30th at 5 p.m. Central Standard Time. Because of the plan changes this year, everyone will need to complete an enrollment even if you are declining coverage or keeping your coverage the same. This process will be completed through your ADP portal. Where should you turn should you have any questions or concerns? In our office here at CLS Partners, we have a team of benefit advocates dedicated to assisting employees and their families with any questions or concerns that they may have. The benefit advocates are here to assist you with enrollment questions, claim questions, provider location, or just to confirm something you might have heard in the presentation. And last but not least is the contact information for your benefits carriers. This information is also on the handout provided to you during open enrollment. Thank you for your time and attendance. Again, if you have any questions, please feel free to reach out to us at CLS Partners or your Human Resources Department.